Thanks everybody for coming today. I feel very privileged to be here. It's great to see an event all about tinnitus. It's something that is well needed. And today's presentation really, the aims of it are to educate you so that you can learn a little bit about the ear, how it works. You can learn a little bit about tinnitus. It's a practical session as well. And please feel free to ask some questions at any stage. So a little bit about myself. I've worked 10 years in different NHS hospitals. I've spent 2 years at the Eye and Ear Hospital, head of audiology at the Mater for 8 years, and also 2 years at an ear clinic. And this is my little baby. This is Crinkles, and he's 1 currently, and he's absolutely adorable. And his hearing is excellent, especially when you say sausages. So tinnitus, what is tinnitus? I mean, we've covered this today, but I mean, the summary is it can be any sound that doesn't correlate to the external environment. So whether it's a buzzing, hissing, music, it can be one sound, it can be many sounds, it can be from inside your head, inside your ears, from outside your head. So it's any of those sounds. It can also be a pulsatile noise as well. And there are many, many different types of tinnitus. And that's why we just have a blank slide for the next slide, and that's because there's so many things about tinnitus that they can't actually all be included on one slide. Listening to Ema and listening to Anne, Absolistic, it's a holistic approach. There are many different interventions, there are different things to try, there is lots of research, there's a lot more funding into tinnitus, so keeping up to date, being educated, being well informed is really a start. So a good place to start that we find in our clinic is really learning about the ear and learning about how it functions and learning about the different parts, because tinnitus can originate in all different areas of the ear. So it's understanding where your tinnitus is coming from and having the appropriate tests is something that is highly recommended. So the outer ear. The outer ear never stops growing, so over time your ears will get bigger and bigger. Same with your noses. So it does consist of the pinna. So the pinna is just the name for this part, the cartilaginous part outside. It consists of the ear canal, which is like a tube, and then the eardrum. Now the eardrum, you can see a normal picture of an eardrum here. It does look a bit like the top of a drum. It's nice and clear. You can see a little line going down the middle, and that's where the little small bones, the ossicles, fix to the back. It's amazing how many people we see in clinic with earbuds stuck inside their canals that have to be removed. So it's fascinating, but earbuds are no longer called earbuds. They used to be, but now they're called cotton buds. And the reason for that is that you shouldn't put them in your ears. Now the ear has its own capability of actually pushing and extruding wax out, and it's only the outer third of the ear canal. So the ear canal is about 2 inches long, and it's only the outer third of the canal can actually push the wax out. If you push wax further in than the outer third, it gets stuck and it has to be removed. So a little bit of wax in your ear is actually quite healthy, but there's also research to show that if you're actually rubbing the ear can actually produce more wax as well. So the old saying is never put anything smaller than your elbow in your ear, and that's because you can't physically put your elbow in your ear. So in other words, don't put anything in your ears if you can. It is okay to actually use cotton buds, to just clean the outside of the ear, but not the inside of the ear. So these are just a few conditions that we would see in clinic, and we would encourage people to always have somebody look inside of your ears with a magnifying torch. If you haven't already, it's just called an otoscope. It's a little light with a magnifier. The doctor can look in your ear, an audiologist can look in the ear, different screening centres can also look in the ear, and it's amazing what you can find. So the first one, you can see the picture here is just of a plug of wax, and it's a completely full plug of wax. Sometimes it's partial, sometimes it's very soft, sometimes it's very hard and actually sticks to the ear canals. The second picture there is a perforation, which is a hole in the eardrum. Now, if anybody's had a perforation, what you'll know is if water gets in the ear, it's very painful. And it also causes further infection to the middle ear cavity as well. The third picture you can see looks a bit like a cave, like stalagmites and stalactites. And this condition is known as swimmer's ear. And swimmer's ear, again, is very, very common. If you swim at least once a week, you can actually develop swimmer's ear. The cartilage in the ear canal is actually sensitive and it's prone to change. It's continuously growing, and water and temperature change can actually affect how that cartilage grows. So if you are a swimmer, do use ear protection for swimming. So there are different types of swim plugs that are very cheap and generic. You can stick into the ears, and there are also some swimming hats actually with ear pockets on them that actually cover all the way over the ear and that can prevent water from getting in. Custom moulded earplugs are also available from many clinics. Any clinic that sells hearing aids or audiology clinic can make you custom moulded ears, and they literally are earplugs that fit exactly the shape of the ear. So you have a cast taken of the ear and they go in nice and neatly, and it just means that you're protected.
And that would stop from the water from going into the window.
Now, an earplug on its own doesn't 100% stop water from going in the ear. And the reason for that is that when you talk, when you move your jaw, the ear canal also changes shape. So the general advice is always use two forms of protection. So you need a plug and a hat, or you need a plug and a swim band. There are also different things like ear putty that's available that looks a bit like blue tack. Now the secret with ear putty is you don't push it all the way in your ears. You put it in a blob and you smooth it into the ear so that it doesn't go too far in. So use a plug and use some kind of swimming hat or swimming band. It has to be two things in combination, because there's no one type of earplug that can be 100% proofed for not letting water in. And it's the same with children as well. There's children's earplugs that you can get if you've got kids, nephews, nieces, grandchildren taking swimming lessons. It's worth investing in some earplugs for them.
Sorry, if you're not swimming frequently, should it necessarily be a problem? And secondly, does it matter the water that you're swimming in, whether it's indoor or sea or...
Sure, it's a good question. So the question is, should earplugs be used even if you don't swim regularly, and what type of water should you use earplugs in? We tend to take a very cautious approach and just say just use earplugs no matter how often you swim and no matter which water. Especially if you're on holiday, sometimes it's difficult to know actually the standard of the water that you're swimming in. But interestingly enough, cold water can actually cause these little lumps and bumps a little bit quicker. So kayakers and surfers, it was amazing when I worked in Cornwall, all the surfers, they did have a more pronounced swimmer's ear because of the temperature of the water. So cold water does tend to result in a quicker growth of these. Foreign bodies, so especially kids, if you've got kids tugging at their ears or they've been itching their ears or they're not quite hearing properly, just check they haven't pushed something into the ear. We've seen...
Yeah, what causes that itching? You get that all the time?
Yeah, so ear itching, it can be from numerous different causes, and the first thing to do in that situation is actually get somebody to look in the ear, get the GP to look in the ear, have adequate tests done, and then seek advice depending on what your particular condition is. But itchiness can be caused by lots of different things, and we do quite often see that dry skin can cause itchy ears, because if the skin in the ear dries out, it becomes flaky and it becomes itchy. So simple things like ear drops, only if they're safe to use, can actually help that situation. Insects, I hope nobody's squeamish in the room, and I will change the slide soon, but we have seen the odd insect crawl into a canal. I think the most memorable for me was a caterpillar. It was looking straight back at me. So the middle ear is fascinating because I describe it really as the mechanical part of the ear. So imagine you've got the drum, and then you hit the drum. Behind the drum, there's these three tiny, tiny little bones. And you can see on the picture on the top right corner there that the bones are extremely tiny. And the job of those little bones is to transmit the sound, conduct the sound across the middle ear cavity. Now, the middle ear cavity also leads to the nose. So when you swallow, when you yawn, air goes through that little eustachian tube and your ears, the pressure equalizes. Now, you might be wondering why I've got a picture of a crunchy bar on my slide, and that's really because the mastoid bone, which is the bone surrounding the ear and surrounding the ear canal, is a bit like a crunchy. It has all these little air pockets in it. It's not like other bones in the body. So if you get an infection in your ear, the difficulty is that the infection can spread from one little air pocket quite quickly to the next. So the take-home message here is if you've got discharging ears, if there's anything a little bit unusual with your ear, pressure, pain, get it seen to as quickly as possible. Once the infection spreads, it can become quite radical. There are complications like encephalitis, meningitis, brain abscesses, and it really is earlier is better, like any health intervention really. So the eustachian tube has a very important function, and that's to ventilate the middle ear space, but it also allows the eardrum to move freely. If you think about it, the pressure on one side of the drum and the pressure on the other side of the drum needs to be equal so that the eardrum can move. If the pressure is negative behind the eardrum, so imagine you've been up on an aeroplane and the pressure is different in the middle ear cavity to the external environment, then your eardrum just doesn't move as much. The ears have to pop to be able to hear. So the eustachian tube has a very important function. Yawning, swallowing, drinking water, all of those things open and close the eustachian tube. This picture is quite interesting of a child versus an adult because, as you can see, in an infant, the eustachian tube lies a lot more horizontal, so it isn't fully developed. And you do find with children, it's quite common for them to develop clogged ears, glue ear, and sometimes they do grow out of it, but sometimes they need some intervention to help. So conditions of the middle ear, as you can see, instead of the picture on the top right where you've got a nice clear eardrum, you can see some fluid, some yellow discharge actually behind the eardrum there, and that would be glue ear. The picture next to it is something called a grommet. It's a very simple surgical procedure, and the grommet ventilates the middle ear cavity. The next picture are the middle ear bones, the ossicles, and you can see the little kind of pink fluffy ball that's attached to the stapes there, and that's actually a bony growth. And this is something called otosclerosis. Now these otosclerosis and other problems of the middle ear can be tested quite simply as well with something called tympanometry. Now tympanometry is a very quick pressure test that's done of the eardrum. It doesn't take long, it's painless, you feel a bit like you're going over a hill in a car, and the purpose of that test is to look at the mobility of the drum, to see if there's any holes in the eardrum, to look for congestion. So if you haven't already had a pressure test of the eardrum done, it's just one of those things that's a very practical thing to do. The very end picture there is something called ossicular discontinuity, and that's where the little bones are broken. And sometimes we see this when there's been trauma or a car accident, and the bones can actually dislocate. So it's another thing that can be tested and checked for, and all of these conditions can contribute to you having noises in the ears. Now we move on to the inner ear, and the inner ear is a bit like a snail shell, really. It's full of little hair cells. So if you unravel this snail shell, it's a bit like a piano, and each little hair cell responds to different notes. The other thing it's like is, I suppose, a field of barley. If you hear a sound, all these little strands waft away. But if you hear a loud sound, if there's a strong wind, they all get knocked down. So you have to be very careful about the level of sound that you're exposed to. And those little hair cells are extremely tiny. And if we think about the cochlea and how big the cochlea is, it's smaller than the size of a pea. It's smaller than a pea. So you've got such a very clever organ that's doing all this processing, and yet is so tiny and fragile that you do have to really mind it. So here's
the hair cells in your ear, when they're damaged, that interferes with your hearing also, doesn't it?
Yeah, so the question is, the hair cells in the ear, if they're damaged, does it interfere with the hearing? Yes, it does. And it can also cause tinnitus as well. So hair cells are very fragile. They can be knocked down. typically you will see hair cell damage. These particular pictures are exactly of that. They're of damage done through loud sound exposure. So in the top picture here on the top left, you see a lovely uniform pattern of the hair cells. And in the picture below it, you see it's a bit like a hurricane has passed, where some of these hair cells have disappeared, they've been flattened, some are still standing. On the right picture, again, you can see a lovely kind of M shape, and then the picture next to it, you can see the disruption there. There's lost hair cells and there's flattened hair cells. So common levels that can cause damage. So if you're at a rock concert, it's a dangerous level and it can cause damage to the ear. If you've ever had temporary ringing that's lasted just for a little while and it's recovered, if you've ever had dullness of hearing, these are temporary shifts, and you should think of those as warning signs that the ear is actually saying, I've had enough sound. If you've any noisy hobbies, or if you work on a farm, if you use drills and saws and lawn mowers, always use ear protection as well. And it's nice to have kind of a set of ear muffs at home, just in case there's anything noisy that actually happens. And if you've worked in a noisy environment, there are regulations to protect us. But with social exposure to sound, there isn't really any protection. It's really down to the individual. If you choose to put yourself into these environments, then you're accepting that damage can happen.
Sorry, is there any legal requirement in public spaces such as clubs, pubs, restaurants to have the noise at a level that isn't causing health damage?
Yeah, it's a good question, and that's about, is there any regulation for social environments? For staff, yes, but for people attending, no. And this again is something that might be a bit of a gap, and it's up to yourselves to wear the adequate ear protection or take regular breaks from the sound. But there's nothing really there to protect you as a consumer of an environment that is loud. So what I'd like you to do is really think about your most favourite treasured musical instrument, favourite possession. Have you all got that in your head? Mm-hmm. Okay. Now, smash it up. And that's really what you're doing when you're opting to go into these loud, noisy environments. You're causing damage to the ear. But the difference with the ear is that you can't actually just go out and buy a new one or buy a similar one. At this stage, it's not possible to regenerate the ear. So do look after your ear. Other conditions include things like tumours. This is a picture of an acoustic neuroma. So the picture on the left, we can see the cochlea, the little swirl, and behind it is the internal auditory canal and the cochlear nerve, which is the 8th nerve of hearing. And then we can see a little tumour there on the right side. Now, the acoustic neuroma is just a space-occupying tumour. It's benign, it's not malignant. But what it does is it can grow and grow, and it can press on different nerves. It can influence hearing loss, it can influence tinnitus. Typically, what we say to people is if you have hearing loss in one ear, if you have noises in one ear, or if anything happens just on one side, go and get help. And that's a really important thing to do, because typically the ears tend to go down symmetrically when it's through age or noise or other processes. So that's just a little warning sign. The other thing that we'd recommend that you get immediate help for is if anybody ever has a sudden hearing loss. We do see this in our clinics where people will turn up and say, I was asleep at night and I woke up in the morning deaf. My hearing just went. You've literally got 48 hours to get yourself to an accident and emergency, and typically they will treat you with steroids, and steroid treatment for sudden hearing loss is very successful. So if you know anybody that this happens to, don't let them wait around, get them straight into A&E and get that actually looked at. So again, the message is earlier the better. Hearing test. So Anne did cover a hearing test, and this is just, again, this is a picture. It's good for you to know what they look like. It's good for you to know how to read them. I've handed out these little ear record books for you. The purpose of those little ear record books is that you can keep your own records, no matter who you see, where you go, record your own hearing graphs. You should be able to read your own hearing graphs and be able to compare how things are changing over time. So at the top of the graph, so the left one is a blank audiogram, just a grid. And the right one is one with a normal test on it. You see the crosses are the left ear and the circles are the right ear. And you can see all of those responses are quite high up at the graph, and they're above 20, and that constitutes normal hearing, above 20. Now the little kind of symbol below it and all the letters are where we hear different speech sounds. So different speech sounds have different pitches. So vowels typically tend to be bassy, consonants tend to be more high-pitched. So depending on if you have a hearing loss or what pitch your tinnitus is, it might actually mask a little bit the types of some of the letters that you're trying to hear, which means you hear some of the word, but maybe not all of the word. And the interesting thing is the brain will fill in the missing parts. So you can be convinced you've heard a word, but actually it could be a completely different word. So here's a little graph that just shows us what noise-induced hearing loss looks like. And again, the symbols at the top, that shows normal hearing. But that V shape, you see that sharp V shape in the audiogram, that's very, very typical of noise damage. So if you've had a hearing test done and you've got those little V shapes in your graph, you need to be very careful. You need to do something so that you can help prevent that getting any worse. So hearing reduces constantly over lifetime. So it's not the case that when you get to a certain age, your hearing drops. It's from teenagers to 20s, 30s, 40s, 50s. And if you get time to look up a YouTube video, there's something called How Old Are Your Ears? And play it in front of the family, because it'll play all these little tones and people raise their hands when they hear the tones. And gradually you see people not putting up their hand. And even from your 20s to 30s to 40s, your hearing is just gradually getting worse. And this is a graph that shows us that it's typically the high pitches that are affected. So your ability to hear high-pitched consonants tends to be reduced over time. If you do have a hearing loss, also it's good to get the family assessed. And this is because some types of hearing loss are hereditary as well, and they have particular shapes in the graph. Other things that can speed up the reduction of hearing are medications. So if you're on strong antibiotics, if you're under any treatments, so we would routinely test oncology patients for hearing loss. Disruption in blood supply can cause hearing loss. It's just important for you to note all these things down. So have a list of the medications. If your hearing reduces after you've changed medication, then do let your GP, do let your doctor know, and take the medication back with you. Hearing aids and tinnitus. So hearing aids are very good at diverting attention away from tinnitus. And if you think about it, if you've got a hearing loss, you're not hearing certain sounds very well. When you wear a hearing aid, you're hearing things better. So a hearing aid is really a good place to start, to trial. Go to an audiologist, go to a local centre. If you haven't already, if you do have hearing loss combined with tinnitus, it is an excellent thing to start using. Ear protection. So everybody, it's a modern day essential. We do live in a noisy world, and nowadays there's no excuse, because earplugs, there's a variety of different types and they're generally very cheap. But earplugs will protect your hearing system. So if you have tinnitus, something not to do is go to sleep with earplugs in. So if anybody is using kind of the foam earplug because they have tinnitus and they think that's going to make it better, that's something that you shouldn't do. Now, if you wear a foam earplug and you have tinnitus, what you're doing is you're making the sound louder to the brain. If you've ever blocked and covered your ears, what you hear is the workings of inside your ear. And if you have tinnitus and you block your ears, you'll actually hear your tinnitus louder. Sometimes we do see people coming into the clinic and they say, well, I've got noises in my ears, so I've decided to do something about it. I'm wearing earplugs. That's the worst thing you can do, because it's actually increasing the signal of the tinnitus up to the brain. There are, however, different types of earplugs that work very well, especially if you're in noisy environments. So if you have tinnitus, if you find yourself withdrawing from environments like weddings, the theatre, social situations, because you're scared about the tinnitus getting louder, well, there are now lots of different types of earplugs that actually allow you to go into these environments to hear very well, and also it conserves your hearing. And these types of earplugs are called filtered earplugs. So the principle of a filtered earplug is it lets normal sound into the ear. The louder sounds, though, there is a resistance. So people like sound engineers, dentists, air stewardesses, bar workers would wear this type of earplug so that they can still hear, so that they can still do their job, but they're preserving their hearing. And if they have tinnitus, they're helping prevent it get louder. So this is just an example of a small kind of filtered earplug. These are typically about €20 a pair. They're generic, they're kind of flanged, and you just pop them into the ears. Next type of earplugs are moulded. So these are a bit more accurate, and the frequency response is a bit more accurate. And you can see in the ear, they are quite neat, and they just push in. Again, at most hearing aid centres, most audiology clinics will be able to make these for you. Just go to your local dispenser or your local shop and have a cast of the ear made. They're a worthwhile investment. They last approximately 3 years, and they're a very good protector. So for those who love music, sometimes people worry about still listening to music because they've got noises in their ears. Well, there's lots of general rules of thumbs and things that you can do to help. So picking the right set of earphone is important. It is possible to get custom molded earphones. What that does is isolate the external sound and means that the level that's delivered to the ear is quieter and more accurate. So the message there is louder is not necessarily better. So preventing hearing loss and tinnitus. So do use ear protection. Have a set of earplugs just around the house. Even if the fire alarm goes off, it's going to be very loud. Have something handy. Reduce the volume where you can. Be aware of the level and intensity of noise that you're listening to. Avoid loud, prolonged noises where possible. The 60-60 rule. So the 60-60 rule is 60% volume for 60 minutes and have a rest. Now, having a rest is also important. If you think about if you're driving in a car and you stop at a petrol station, you get back into the car and the radio seems very, very loud. And that's because your ears habituate to sound. So by just taking a rest away from the sound source and coming back into the sound source, your ears can reset themselves. Ensure your hearing protection device is given accurate seal and are in good condition. Sometimes people bring in ear muffs that they've had for 20 years and they're still using them, but the problem is they do need maintenance, they do need to work. So check the seals are okay, and check, especially if you have anything custom molded, that because your ear is growing over time, if it gets loose, then you do need it recasting again. Incorporate healthy hearing into your lifestyle. So have a healthy hearing screening program, have a hearing test done, do get advice when you need to. Promote protecting your hearing amongst family and friends. Awareness, as Emma was saying, we do need more awareness about hearing. The ear is one of the most neglected health organs, and we've interviewed people on Grafton Street about this, and it typically can take people 4 or 5 years to get help after the onset of hearing loss, tinnitus, any symptoms in the ear. For some reason, people seem to wait when it's in relation to the ear, whereas what you should be doing is a bit like if you had a bit of blurring of vision, you go straight in and have it looked. So earlier, the better. And regular testing should be done. So family and friends can help. Encourage healthy hearing programs, get a regular test, have somebody look in your ear, get a pressure test done of the eardrum. Incorporate good communication skills. So it can be very hard to concentrate when you have tinnitus. It can be a strain. People can sometimes be a bit more tired as the day goes on because they're having to constantly listen over this intrusive sound. So being clear, getting somebody's attention before you speak to them, not covering your mouth when you speak, being at the same level as them, making sure good lighting is on in the room so that you can encourage lip reading as well. These are very practical communication skills that should be done no matter if there's a hearing loss, tinnitus, or normal hearing. Good communication and getting somebody's attention does help. be informed and up to date. So there are many, many places to get information about tinnitus, and if you Google it, there's pages and pages, but what you need is very much information that's well researched. The British Tinnitus Association is excellent. They have funding, they have audiologists, they have researchers, they have a huge board of very talented people all working to give up-to-date information. Attend appointments with your loved ones. So if you know somebody who has tinnitus, go with them. It will give you a much better understanding of what's actually happening for that particular case, because everybody is different. It's not the case that tinnitus sounds the same or affects somebody the same. It affects people in very different ways. So, and you're welcome also to make contact at any stage to us here at the ear clinic. So we're just based opposite Eccles Street. We do a lot of research, and we often get kind of test devices that we're looking for candidates to trial, whether it's hearing aids or tinnitus products or swim protection. So don't hesitate to drop us a line, drop us an email, or drop us a text, and come in and get advice and get tested. But also there are many very good hearing clinics around the country, and getting a screening test or a diagnostic test or getting early help or hearing aids is really a good step towards helping your tinnitus. So is there any questions? I know that's quite a lot of information, but hopefully the aim of the session is really to give you some education, to give you information, and that's, as has been said, that's where you need to start. Get informed, get well informed, and then explore what options are out there, and maybe try a few different approaches, because there isn't one solution that suits all. Right, thanks very much. Thank you.